Hello everyone. I'm Dr. Kirtivasan from National TB Elimination Program. I just want to introduce you to a new initiative that is hybrid training for LTs. Now, we are introducing a new training format for LTs under our program. So let's see what is this hybrid training format. So unlike our conventional training, which we schedule here in our IRL or state TV center, so this will have a virtual component to it. So here the theory part will be conducted through a echo session with Zoom, which is actually a virtual platform. So this will be like a weekly once, most likely on a Friday, 1 hour block. So that will be online and it will be real time. In the sense the participants can participate in it and they can ask their queries and we can troubleshoot real time. So this is a ecosystem platform. It's a one-time registration process. We'll get in touch with our LTs and guide them in this process. But there are situations where that particular LT may not be able to attend that particular time frame, either because he's on leave or he's sick or he's obviously they are quite busy and they're not able to attend. So we'll be giving abridged versions of these videos through WhatsApp. For the theory evaluation, we'll have a post-test MCQs, few MCQs, maybe 5 to 10 MCQs will be there to evaluate how they have understood the theory component. Practical component, as for any training, the practical component is very important. So here, unlike the conventional training, we have an on-site practical component. So that is, as they do the particular test or particular process, there will be on-site examination. There will be personnel from our program who will come and observe them how they are doing that particular process, and we have a detailed checklist for the same. We'll have feedback from our LTs and also we give certain feedbacks to our medical officer in charge regarding this process. And there will be obviously a certificate issued at the end of this training. Now, what is the need for this particular initiative? So it is quite obvious due to the current pandemic situations, traveling from one place to another, there are a lot of apprehensions regarding that. And not only that, our topography or Andaman Nicobar Islands has its own travel related issues. Friends from other districts in North and Middle Andaman, and especially our friends in Nicobar, they're not able to travel on a particular date and time because of a little irregular travel schedule. Most important, there is shortage of LTs. LTs are very important, an integral part of your daily functioning of your PHI. We understand that. So that is why even when we conduct conventional training, it is difficult to send a LT for the training for 2 to 3 days or even sometimes a week. So it is difficult to run the PHI without the LT services. So we understand that part. And mainly, we want to keep this learning process continuous and we want all our LTs to be up to date with the latest protocols and guidelines in our program. Last but not the least, the support of medical officer in charge, that is yourselves. This is mainly to sensitize all the medical officer in charge. And any program cannot be success without your input and your guidance and your active participation. So I humbly request you to support us in this new initiative and sensitize your lab technicians to be part of this training and to benefit from this training too. Now, for example, from next week, we'll be starting NAT training. So there are different types of tests which we do in different laboratories in Andaman and Nicobar Islands. One is a molecular test that is done through two different types of machines. One is TrueNAT and the other one is GeneXpert. Other one is our simple sputum staining microscopy. So next week we'll be starting training for TrueNAT. So it will have, for example, theory component. It may have 3 parts. So there will be a weekly Friday 12 to 1 echo session. And those who miss that will be sent this abridged version of this training in a WhatsApp video and the post-test MCQ will be conducted. Practical on-site part of this particular training will be on-site troubleshooting in the sense that when the senior TB laboratory supervisor or IRL microbiologist visit that particular site, they'll observe how the LT does the test, they'll observe each and every process, and if there are any discrepancies, they'll troubleshoot it on-site. There will be a detailed NAT site report which will be prepared and the feedback will be shared to medical officer in charge. Other than this, we have an external quality assurance program from the Central TB division. Here are five samples which are actually dried sample, and these are sent from our national reference laboratory to the particular sites. This currently it is done for gene expert machines, and soon it will be implemented for TrueNAT machines too. So here we test these samples. They check how the LT runs the sample and how they're able to report the particular result. And that is compared to so many sites, so many different sites all over India, and they give us a report, and we have been doing quite well in our Gene Expert EQA. There will be a training report which will be shared with you and the feedback also, and the certificate will be given to the LTs at the end of the training. Similarly, sputum examination, the staining training will be initiated after that, and we have different types of sputum examination here. District headquarters, we follow fluorescent staining, and other places we follow Ziehl-Neelsen or acid-fast staining. It will have a theory component similarly with 5 parts, and it will have a practical component, on-site component. So here there will be a random check-in. So this is unblinded random check-in. So whenever the STLS or IRL microbiologist visits that particular site, they'll randomly pick 5 positive and 5 negative slides, and that will be examined there. And if any discrepancy is there, the LT will be intimated and he will be shown what type of error that particular slide has. So this is unblinded in the sense both the person who is being tested and the person who is examining testing, the supervisor, both are aware of the results. Other than this, we also have another format which is called a randomized blinded rechecking of slides. So this is blinded in the sense, no, the person who is testing is unaware of the results. Okay, so here, based upon the annual negative slide volume of your particular site, there is a formula to calculate how many number of slides have to be taken from a particular site. Many sites, all the slides are taken. These slides reach here at IRL, and the person who checks these slides are a different set of personnel, a different set of STLs. They don't have the results available with them, so they freshly stain and they recheck these slides, and those slides results are then compared with your LT results. If there is any discrepancy, further there is a third reading which is done by an umpire, and if any discrepancy is there in the final reading, the feedback is given in the form of Annexure D to the particular LT and also the medical officer. In addition to that, we will be initiating external quality assurance for slide testing also, that is 5-slide panel test. So these will be unstained smears which will be supplied either by district or through IRL to our LTs. And these unstained smears will be stained and the results will be reported by the LT. And this again will be cross-checked by our STLS, and these slides will also be sent to IRL for a umpire reading. These many cross-checking is done so that our results which are given by our LTs are reliable and the discrepancy is as minimal as possible. There will be a training report, there will be feedback for it, and there will be a certificate also for it. Thank you for your time. Kindly continue supporting our program as we move towards our NTB goal. Thank you.